Hi, my name is Adam Scheingate. I'm a professor in the Department of Political Science at Johns Hopkins University. Thank you for joining this session of Hopkins at Home on the politics of pandemics. Before I get started, I just want to remind everybody that we will be taking questions during the session, and you can type your questions into the Q&A box right next to the video you're watching. That'll go to a moderator who will then send your questions on to me. So what I want to do today is walk you through a couple of ways that political scientists and other social scientists have thought about crises and the role of government and the responses of government to those crises. And once we think about those frameworks, I then want to apply that to our current moment and thinking about how governments in the United States and a little bit around the world have been responding to the current pandemic. So really three questions that I want to talk about. Who deserves help? Who is responsible, which is also a way of asking who do we blame? And also who do we trust? And that could be government or it could be private actors. Who do we trust for information about a pandemic or public health crises as the one we're experiencing right now? So let's start with who deserves help. And here I want to introduce you to the work of Ann Schneider and Helen Ingram, an article that they published in 1993 called The Social Construction of Target Populations. And what they mean by social construction is really the use of stereotypes or cognitive shortcuts that we use to classify individuals into groups that we believe are either deserving or undeserving of government help. And sometimes those stereotypes come from biases that we hold. Sometimes they're basically cultural stereotypes, but they do shape our perceptions, and that Schneider and Ingram argue also shape the way we decide who deserves help. So they have this framework, this fourfold table that I'll just walk us through real quick. Here on the top horizontal axis, we have constructions. Again, these are the stereotypes that I talked about, and we have either positive or negative perceptions of groups. Then here on the vertical axis, we have power, whether we think groups have resources that make them strong or weak in terms of their ability to get what they want or to be heard in politics. And so then you see we have four categories as a result, and we look down here. These are groups that we think are positive, we think positively towards, like children or mothers or disabled, but we don't see them as being particularly powerful in society. And we might contrast that with groups that we think are powerful, but we have maybe negative perceptions of. Or groups that we have positive constructions of that we think are also strong, or groups that are weak, but also we have negative views of. And this framework, according to Schneider and Ingram, influences how we think about benefits and punishments in policy. And we can think about how that might shape who we think is deserving or undeserving. And in fact, more recently, some researchers used this framework to conduct a survey where they actually asked Americans how they would categorize different groups. And this comes from work by Rebecca Kreitzer and Candace Watts-Smith. And I'm going to try to zoom in here so that you can see a little bit more closely some of the groups, and hopefully this shows up on your screen. But as you'll see, they use a similar set of axes around power and deservedness. And as you can see here in this area, the lower left panel, these are the groups that we think are deserving, but maybe not particularly well-resourced or powerful. These are groups here that we might see as deserving, but also powerful. Groups here that are undeserving in people's views, but powerful, and groups down here that we might think of as undeserving and also lacking power. So the finding here is that Schneider and Ingram's framework does map on to people's opinions about who deserves help. And so we'll come back to this a little bit later to think about government responses to COVID. So next I want to think about this question of how we assign responsibility or blame for crises. And to do that, I want to introduce you to some work by political scientist Deborah Stone in a book she wrote called Policy Paradox. the art of political decision making. And I just want to read a few quotes from her work. Complex causal explanations are not very useful in politics, precisely because they do not offer a single locus of control, a plausible candidate to take responsibility for a problem, or a point of leverage to fix a problem. So what does she mean by complex causal explanation? Well, here she's just an explanation for why something happened. And we know that the world is very complex, complicated, and as we try to understand cause and effect, it can be difficult. And her first point here is that complications and complexity are not very useful in politics. In contrast to somebody like me, a social scientist, I love complexity. I love to think about complex causes of social problems, but that's not very useful in politics. And from that observation, Stone also comes up with a framework that I think is useful for us to think about this current moment. What she calls causal theories or causal stories. Again, what she means by that is the explanations that we use to understand why something happened. And so here she has, again, looking at the top vertical axis here, consequences. Was something intended or unintended? And then here on the vertical axis, was it unguided or guided, or she puts it here, purposeful? And so the easiest category perhaps for us to think about is something that we just think of as an accident or an accidental cause. Something like nature or weather or earthquakes. They happen. The explanation is straightforward. It wasn't intended by anybody and it wasn't guided by anybody. And we can think about that in contrast to something that was intentional and was purposeful, and what she calls an intentional cause. Intentional oppression of somebody, conspiracies. And then here we have some kind of intermediate categories that are a little bit more complicated, perhaps. Something that happened that was inadvertent, unforeseen side effects, that it was the consequence of a purposeful action, but the consequences were unintended. Or something that was intended, but not necessarily guided, something like a machine that was designed to perform a certain function, but then caused harm. And again, I think this is a framework that's useful for understanding what's going on right now. And in fact, not just in this current moment, but a big part of what happens in politics is that individuals and groups struggle over these causal stories. And so let me just read through these other quotes from Stone. In politics, causal theories are neither right nor wrong. They are ideas about causation and strategically portraying issues so that they fit one causal idea or another. So Stone's not saying that there isn't truth out there. It's that there's going to be competition in politics over how we understand why something happened. And when we ask why something happened, we're actually assigning responsibility and blame. And so the second quote here captures that. Political conflicts over causal stories are therefore more than empirical claims about sequences of events. They are fights about the possibility of control and the assignment of responsibility. And so again, I think that this happens a lot in politics, and in fact, most crises or events, I think, can be understood through this framework and through efforts to try to compete over defining cause and effect. And so we can think about that in light of the current crisis. But let's before using the current crisis, let's just take an example that I think illustrates this nicely. As I said at the outset, something like an accidental cause like the weather. So take the example of a hurricane. A hurricane might be a classic example of something that we assign accidental cause to. It was unintended and unguided. But the consequences of that hurricane then enter into a whole bunch of different discussions depending on how governments respond to it. So for example, if we take, you know, Hurricane Katrina, for example, the loss of life in Hurricane Katrina, how do we assign responsibility and blame for that? Do we say that it was just the result of an unfortunate and unintended event, the weather, in this case a hurricane? Or do we attribute loss of life in Hurricane Katrina to the failure of levees that were constructed and managed by government and perhaps not maintained effectively? Or do we assign blame to local or state or federal government responses either in the run-up to that hurricane and decisions about whether to evacuate people, or in the aftermath of that hurricane in terms of delivering aid? So very quickly, what you can see is that something that initially might appear to be accidental, where we don't assign any individual or group's responsibility or blame, then can become a question of, was it intentional, these actions? Was it inadvertent? Was it something that could have been foreseen? And the point that I want to make here is that when we have complicated, complex events, there are going to be political struggles over defining responsibility and blame. And that in turn has really important implications for public policy, because essentially what we're doing in public policy is deciding what to do. And when we ask what to do, we're assigning, again, responsibility and blame. And to go back to what I was discussing before with the social construction of target populations, to try to add these two frameworks together, now when we think about first who is to blame or who is responsible, that in turn leads to what we should do about it, what kind of solutions we might pursue. And of course, that then asks the question of who will those solutions benefit, and then who do we think deserves those benefits. Of course, another caveat here to keep in mind is just because we think somebody is deserving of help, there may be other factors that influence how and why governments act in a certain way. And that's something that we can come back to at the end as well. So we may have public support for certain kinds of aid to groups that we think are deserving, but there's a different stage there that we have to think about as well, the political process, where different groups may have different levels of opportunities to influence outcomes. So let's keep that in mind too, as we think about why governments act the way they do in response to a crisis. Okay, so let's now think about the third question that I posed. Who do we trust for information? And again, this is a really important question to think about, not just as it relates to a pandemic, but in any kind of government question, health communication question. And for this, I want to think about a work by the sociologist Sheila Jasanoff in an article called Civilization and Madness, the Great BSE Scare of 1996. Let me, for those of you who might not remember this, in the mid-1990s, there was a controversy in Britain over whether BSE, which you might recognize as mad cow disease, had entered the food supply. And this was a really interesting case study, perhaps an extreme case of loss of trust in government. And that's because in the run-up to this period of this particular crisis, information had been gradually coming out that there was a disease that was prominent in cows, in cattle. And the question was whether this disease could jump species from animals, from cows in particular, to humans through the food that we eat, in particular through eating beef. And there was some initial studies that suggested that this disease could jump species. There was a disease in humans that bore a great similarity to mad cow disease called Creutzfeldt-Jakob disease. And the question for scientists at that moment was, was the cause of this disease the result of this disease jumping species? And what also made this an important and interesting question for public policy was whether the source of this disease was due to certain practices in the livestock industry, in particular using cattle feed that contained protein from sheep. There was a byproduct of the sheep industry that was then used in cattle feed in order to accelerate growth in cattle. And there was a disease in sheep called scrapie that then jumped species to cattle. And so this raised a lot of concerns that possibly this exposed people to this disease. And through this period of scientific uncertainty, where it wasn't really clear whether or not this posed a risk to humans, the government in the UK consistently said that there was no risk, and tried to reassure people that there was that it was perfectly safe to continue eating beef. However, as more information became available, the certainty with which the government kept delivering that statement diminished, and eventually there was a recognition on the part of the government in the UK that there could be a risk, that the risk was not completely known. And that led to what Jasanoff called a civic dislocation. And as she said, a civic dislocation expressed itself as a mismatch between what government institutions were supposed to do for the public and what they did in reality. Trust in government vanished, and people looked to other institutions for information and advice to restore their security. So again, this is kind of an extreme case where all of a sudden this new disease emerges. There's a long period of time where the government in the UK is saying there's no risk. And then all of a sudden, there's a break and a breakdown. And it's no longer the case that people trust what the government is saying. And as a result, they look for other sources of information. So for example, in the case of mad cow, they lost trust in government. They lost trust in beef that was sourced from the UK. And so they instead trusted the information they received from supermarkets and grocery stores, who could say that their beef came from other sources other than the UK, where this risk of mad cow did not exist. Now, another thing that I think that's interesting to think about is the difficulty that governments have to communicate information under conditions of uncertainty. And so imagine you're trying to communicate the best information you can, but that information itself is incomplete. On the one hand, you obviously want to be honest with what you know and what you don't know. But on the other hand, from the perspective of government, you realize that expressing doubt, expressing uncertainty can also result in anxiety and lack of or loss of trust. And so again, thinking about an extreme example, if you were to get on an airplane and the pilot was to say, well, I don't really know what's going to happen on this flight, but we'll do our best, that would not lead to a great deal of faith in that pilot. Or if your doctor said, I don't really know what's going to happen in surgery, but we'll do our best. Those are difficult questions and conversations to have. So governments are sort of stuck between, on the one hand, wanting to convey information, but also having to present information in a way that doesn't cause more concern. And in the case of the UK government in the 1990s, they did not do that very well. They denied the uncertainty. They denied that there was incomplete information. And then when it became revealed that through this entire run-up, they had been presenting incomplete information or misinformation, there was a loss of trust there. And so again, combining the three things that we've talked about so far, what do we learn from these frameworks to thinking about the politics of the COVID-19 pandemic? So again, working our way backward from Jasanoff back to Schneider and Ingram, sources of information and who we trust for information is really important, again, at a moment of uncertainty, where we're experiencing unprecedented dislocations of society due to this pandemic, where we're facing a novel virus that also jumped species that we did not previously know existed. Who do we trust for information about the pandemic, about public health? And when we think about government, what levels of government do we think about as sources of information that we trust? Running from our local government to state government to federal government to even international organizations like the WHO. Who do we trust for in terms of private sources of information about the pandemic? For example, drug companies, or if we think about Johns Hopkins University as a private source of information, how does that trust come about? How does that trust evolve over time? And then, we think about responsibility and blame, and using the framework of Deborah Stone's work. Again, do we just think about the pandemic as an accident, as something that wasn't intended, as something that could have been, or maybe could not have been prevented? Or when we begin to think about the responses to the pandemic, then we get into the realm of intentional human action. And who is responsible for those responses, for those policies? And therefore, who do we blame when we may think those responses could have been better, or maybe those responses caused side effects or unintended consequences that are harmful for people? And then again, as we started with the Schneider and Ingram framework of social constructions and the role that biases or stereotypes or cognitive shortcuts play, who do we think deserves help given the economic dislocation caused by the pandemic? As we distribute trillions of dollars, a big question in politics, as the political scientist Harold Laswell said, who gets what, when, and how? That's what politics is about. So whenever we have scarce resources that we have to divide up, the question of who's deserving or undeserving really is an important factor. So at this point, I want to run through a few recent and at this point maybe not so recent findings from public opinion surveys and others that I think again illustrate how the frameworks that I just introduced to you about who is deserving, who is to blame, and who do we trust can maybe help us understand why we see the political struggles we do at the moment and why we see the different responses in the United States and maybe in other countries to the pandemic. So the first thing I want to look at, here's a survey that was taken in April, asking who Americans think deserve financial assistance. And perhaps no surprise in this result that 84% of respondents think that small businesses deserve support, but only 15% believe casinos deserve support, or that 25% believe cruise lines deserve support. And so it's interesting to think about this response and how this reflects views that Americans have about people who might be deserving or undeserving of government support. So when we think about small businesses, or let's say we think about restaurants, which in many cases are also small businesses, it's likely that this result suggests that those groups are seen as positively constructed in people's minds or deserving, but not particularly powerful. And so we think of them as being worthy of government aid. We think of them as being suffering unintended side effects of the need to close these businesses in order to stop the spread of the virus. On the other hand, we might not think that either casinos or cruise lines are particularly essential, or that we think that those are associated with powerful interests that don't need government help, or that maybe don't deserve government help because some Americans might see them as being see them negatively, for example. So again, I think this is a good illustration of this idea of a social construction. However, looking at this, these results also raises an important point that I alluded to earlier, and that is the disconnect that we often see between public opinion and public policy. So there may be widespread support for helping small businesses and very little support for helping cruise lines. But this does not necessarily dictate the allocation of help by government because of all the other factors that go into the decisions that governments make about who gets the resources and aid from, let's say, a bailout. So again, you know, airlines are getting lots of money as a bailout, even though less than half of Americans think they deserve those bailouts. And so again, the frameworks that we talked about today don't necessarily explain everything about government responses, but they might help us ask some important questions about those government responses. For example, why is it that we're helping certain industries when widespread public opinion suggests most of the resources should be going elsewhere? And again, that gets into very important questions about access and influence in our political system, and something that we could come back to if there are questions. So here is, I think, an interesting figure that looks at changes over time in public opinion about the share of voters who say President Trump or the Chinese government is the most to blame for the spread of the coronavirus into the United States. And so again, let's just unpack that a little bit. When we think about blame, we can think about cause and effect. We can think about the framework that Deborah Stone offers us and what stories we tell for why things happen. And so when we talk about the spread of coronavirus, are we talking about the origins of coronavirus? Are we talking about intentional or unintentional acts? Are we talking about perhaps conspiracies about different sources of the virus? These are things that, that Stone foresaw in her framework, and I think we can use here. So, so we see, for example, some changes in the percentage of people who think the Chinese government is responsible for the spread. Now, that could mean something like suppressing information about the virus early on in its course. And then when we look at the trends in terms of assigning blame to President Trump, which for now I think we can just say is a stand-in for government or for the federal government, look at how that change has occurred since from early March to late May when this survey was ended, from 10% to 33%. And so what that suggests is that gradually there's been a change in opinion about the government's response to the virus and what steps might have been taken to slow or arrest its spread. And so again, as we think about causal stories, what we're seeing here is people coming to have a different understanding of what the crisis is. And then if we look at the two, the question of the Chinese government versus the question of government or President Trump, that I think helps us understand what we see sometimes going on a daily basis, which is a struggle over how we frame the crisis or the pandemic. And you'll see different stakeholders, different interests pushing or promoting different explanations over what we experience right now. And so perhaps in response to growing public concern over the government response, we'll see increasing efforts by the federal government or the Trump administration to assign blame on actions by the Chinese government. And so something to watch going forward, again, consistent with the work of Deborah Stone, is, you know, these struggles over how we assign blame for the pandemic. Here's another set of survey results, again, looking at changes over time, and I think is is an interesting way to think about trust and the way in which government responses then influence how people either trust or don't trust government. So the turquoise line here is the United States. You can see there's been a kind of gradual decrease in support for government handling. And what I'm suggesting here is that the percentage of people who think the government is handling the issue of coronavirus very or somewhat well is a proxy or stand-in for whether they trust the government in this case, at least for this discussion. So we see a slow decline in the United States. We see a rapid decline in Britain. We see a sort of steady high level of support in Germany and a kind of decrease but then gradual increase in France. And so it's interesting to think about how that might relate to different responses that those governments had to the virus, and how those responses in turn shape trust. And again, I think that the real challenge here for communication, for government communication, as well as for government response is how to deal with uncertainty, how to deal with the novelty of this particular crisis, and how to communicate that in an effective way to the public. And it's very difficult. I don't suggest it's easy, but as a result, that's going to shape how people perceive government, and that perception, that public opinion in turn will influence the room for maneuver that governments have, for example, to require face masks or social distancing. If you don't trust the government, if you don't trust the messages you're receiving from government, you're much less likely to follow those public health directives. You're much less likely to listen to what government says, and you might look for other sources of information. And as we'll see, those other sources of information might be ones that already confirm your beliefs or biases that you have. It's also important to realize that we live in a federal system, and as we all know, a lot of the decisions being taken around corona are made at local levels, states, for example. And so again, this is an interesting figure to see how there's been change over time in perceptions of government. Unfortunately, this public opinion, these surveys ended in early May, and it would be nice to see how things are continuing now that we're in early June. But one thing that we see here is a rapid decline in some states where we've seen particular spikes in cases like Texas or Florida. So it would be interesting to do some additional research to see if there's a correlation between the numbers of cases and public perceptions. And again, this is a question asking specifically about trust, and again, it's interesting to think about how trust varies. Now, another important thing to say here is that typically, when we look at public opinion surveys, people have more trust in state and local government compared to the federal government. And so I think it's really important to look at how public opinion of state and local responses to COVID are changing over time, and how that relates to various factors in responses and in caseloads. So something I alluded to before is that when we don't trust the government, or when we lose our trust in government, we tend to look for other sources of information. If we look at the UK example, as I said earlier, people turn to private actors like supermarkets to give them information about what was safe to eat. In the context of the United States, of course, it's really important to think about partisanship, and in particular, how our partisan identification, how we think of ourselves as liberal or conservative or Democrat or Republican, how that creates a lens through which we understand the world, and of course, how we think about this current moment. And so it should come as no surprise that we see partisan differences in how people think about the risks of COVID, how we think about trust in terms of government and state government. And here's again some results. Unfortunately, these results only go back to to mid-April. So it would be interesting to see an update of these results. But what we see already at the very beginning of this crisis is partisan polarization over how Democrats and Republicans first think about the risks involved, as well as the sources of advice, the sources of information that they trust. Interestingly, as you can see, Democrats actually have lower levels of trust currently in the federal government, even though we might normally think of Democrats as being more likely to trust the government or more likely to have favorable views toward the government, as opposed to Republicans that tend to be more skeptical of the role of government. And as I was saying before, it's not surprising that you see a narrower difference in opinions of state government. That generally Democrats and Republicans have somewhat consistent views here. And so, what's the source of that? Well, I think it's the strong way in which partisanship tends to influence, for example, the sources of information we look to from media. It has to do with how we associate political party with political control of institutions. And so Democrats perceive the federal government as a Republican institution. And so given that Republicans control the executive branch and the Senate. And so a lot of our partisan beliefs then get projected onto government. And so it's not surprising from that perspective that our perceptions of government actions around the crisis will also be shaped by our partisanship. In addition, I think one of the factors at work here is the way in which we see partisan differences in perceptions of experts and science and scientific expertise. And so that's something that's picked up in this slide. Again, this is somewhat dated. It goes back to April. But as we can see, there has been an increase over time in overall public perceptions of medical expertise. And so I think that's encouraging, and that suggests that at the moment that the crisis, that the pandemic hit, that scientific experts, whether those are in government or doctors or medical and research institutions, that's where we went to look for information. Those organizations have a deep reservoir of trust that we turn to. But at the same time, what you see here is that a minority actually have a great deal of confidence in medical scientists to act in our best interest. And that, I think, is somewhat worrying. And then when we break that down by party, we see some pretty dramatic differences, and that those differences have widened just in the last year. So in the response to the crisis, what you can see on the right panel here, when we break it down by party, is that 1 year ago, there wasn't that much of a difference between Democrats and Republicans in how they perceived medical science. But in the aftermath, or in the initial appearance of this crisis, trust was higher initially among Democrats than Republicans. And again, I think there's a whole bunch of other research that we could look at to think about why that is. I think it relates to the ways in which we see partisan differences over perceptions of expertise, over science. And again, what is the source of that? And that's a complicated question that also goes back to perhaps partisan differences in media consumption, partisan differences in the salience of certain types of issues. For example, scientific issues around climate could be one thing to think about. But what really, I think, the point to bring home here is that this is going to complicate any response by government to the current crisis. If A, there's a relatively low level of trust in experts, and B, there's significant variation in how individuals with different partisan viewpoints think about the role of expertise, and therefore think about the information that's coming from sources of expertise, particularly government sources of expertise. That makes the response, again, very challenging. And we certainly can see that already over questions about appropriate responses, as well as as we go into the summer, and we're entering a period of real, I'd say, uncertainty about what is the appropriate response to social distancing as cases go down. And again, where we're dealing with a rather novel crisis, and certainly a novel virus, there's uncertainty there, and it's difficult to communicate that uncertainty. Here's my last slide, and then I'll try to get to some of your questions. And it's really just, again, a reminder that different groups have very different perceptions about government, and as a result, about the role of government. And so, for example, we see really significant differences here in how African Americans think about official responses and whether or not those are biased. And that, I think, goes back to histories of racial injustice, and including within the medical establishment, that lead to lower levels of trust in experts among, in this case, African Americans. And that also complicates the communication of risk around the pandemic. And as we also see, there are very important differences and disparities in the consequences of COVID for certain populations, with higher severity and deaths among African Americans. And then, as this figure also shows, and given the recent events around police protests, police killings, and Black Lives Matter movement, an important point to bring out here is that for many African Americans, their principal encounter with government is with police. And so their perceptions of police also shape their perceptions of government. And that in turn will shape how they receive information from government around public health crises. And so this makes public health intervention, healthcare delivery more difficult during a pandemic, again, particularly among groups that have low levels of trust in government for historical reasons, as well as contemporary reasons around issues, in this case around policing, that are not directly related to public health communication. So to sum up, government response to crisis depends on societal perceptions of individuals and groups, struggles over blame and responsibility, and trust in institutions, both public institutions and private institutions. And so what we're facing here is a really complicated, complex moment where trade-offs have to be made, and it's not clear what the right course of action is. And in those moments, the decisions that governments make are going to depend on things like who we believe to be deserving, on how the struggle over blame ends up and who wins in that struggle to assign responsibility, and how much trust there is in the public for the experts and the sources of information that we rely on to make decisions at this moment. So let me go to some of your questions now and see if I can answer some of them. So here's a question: what impact would the government have in reporting the progress of an anonymous patient who fully recovered from COVID-19? And I think, I'm not sure I understand the question exactly, but if the question relates to what role that information would play in either public opinion or government responses, I think it gives an illustration of some of the challenges we have around this moment, where it's unclear even what the right metrics should be for tracking or tracing the course of this crisis. Is it recovery? Is it the sort of persistence of symptoms? Is it the severity of the case? And again, I think that's something we're working through. And then also, as we think about the other consequences, particularly the economic consequences, this is where scientific experts can tell us something about the risks that we face, but they can't tell us how to balance the trade-offs between, say, public health and economic cost. Those are moral, ethical questions in some respects, as well as economic questions, and they have to be worked through the political process. And that's another challenge that we face in this moment. Here's another question. Has there been research on whether the healthcare industry, like hospitals, deserve financial support during or as a result of the pandemic? And I think that, let's see if I can scroll back quickly to this one here. And unfortunately, I guess it doesn't include hospitals in this. So unfortunately, I don't think we have good information on that. But I would go back to what I said earlier, which is that one important question for us to ask about the politics of this moment is the degree to which we see a disconnect between what kind of public perceptions might be around who deserves our help and where government resources are going. And again, going back to the Schneider and Ingram framework, some of us might perceive hospitals as deserving because we think of them being positively constructed, but some of us might think of hospitals as being less deserving because of the power that they have in our medical system. Again, those disagreements could have important consequences for politics. Here's another question. How have levels of trust in government shifted during this pandemic in countries around the globe? And is there any notable pattern? And again, I showed us some of that information. And I think that's being tracked over time. I think it'll take additional research to see if there's a correlation between, let's say, cases and public perceptions. I would expect there would be a correlation. But it'll be interesting to study this in the future to see how much variability there is and whether it's somewhat dependent on having relatively high levels of trust to begin with, as well as if they can recover once they go down. Here's another question on partisanship. Why have they split along partisan lines? And as I said, I think there's a lot of different possible answers relating to the sources of partisan polarization to begin with. How much of this is because of our patterns of media consumption and how those are polarized. So the sources of information are polarized. There may also be consequences of kind of confirmation bias, which is a psychological term for our tendency to believe things that are already consistent with our beliefs, or our tendency to believe the information that's already consistent with our beliefs. So, you know, if we come into this moment skeptical of government, and then we perceive government actions as being kind of contrary to what we think is good, that sort of is reinforced. If we're skeptical of public health communication to begin with, then we may not have a lot of trust in the messages that we're receiving. So again, a lot of research out there already on partisan polarization that I think is being confirmed by the responses, partisan responses to this crisis. Here's a question: how much do you think the time horizon on trust has to do with the sentiment that the population has equal access to info, and that in foreign policy we trust for longer, we have less access for information? So I'm not entirely sure I understand fully that question, but the question of a time horizon, I think that, you know, again, let's go back to the case study of Jasnov's of the UK in the 1990s. What that case study shows us is that public opinion can change very rapidly, and that trust, once it's lost, and we experience what she calls the civic dislocation, can take a very long time to rebuild. And so I think that's one reason why public health experts, and particularly experts in public health communication, are very careful about how information is represented, and why governments are very careful about the information that they release, because they know how much of an effect it could have on public trust, and how misinformation, again, if it seemed to have been deliberate or an intentional effort to conceal information, that can have really dramatic consequences. And I think that's also one of the things that, again, we're seeing with let's say, low levels of trust among Democrats in messages from the federal government, where that reservoir of trust has been depleted because of decisions made by the Trump administration. That makes it more difficult then to communicate information during this pandemic. Are there strategies to depoliticize an expert source once it has been politicized? That's a good question. I don't know if any specific sources exist to depoliticize once that politicization has happened. But I do think that, again, public health experts in government, as well as public officials in general, are regularly trying to avoid the perception that they are somehow partisan. Again, there are a lot of people who've devoted their careers to working for public health agencies at state and local government, working for the federal government. It's very important to them that the messages that they put out are not seen as being partisan. And so, trying to consistently provide the best information, I guess, is the strategy there. Are there polls that disaggregate levels of trust based on the public's views of government actions to protect health as opposed to its actions to protect the economy? There could be. I'm not familiar off the top of my head with any that disaggregate levels at that level. Although I think there are, for example, we have public opinion surveys looking at specific agencies, for example, the FDA. And the FDA has a particular history of protecting public health by preventing dangerous drugs from getting on the market. And we've seen that trust being fairly steady, although we've also seen trust in the FDA decline in moments when there's been medical adverse effects of drugs that the FDA had approved. So again, another illustration of the sensitivity of public opinion to those kinds of events. Is the current bifurcation or lack of trust baked into the two-party system? Do countries with more parties and coalition governments have more trust, or is it further splintered into smaller fractions? That would be a great question for further study, whether or not, again, there's a correlation between party systems and public trust. There could be, I'm not aware of any. I think it would also be interesting to see, again, whether partisan differences relate to trust more generally. For example, we saw in that figure I showed earlier a pretty rapid decline in trust in the UK around COVID that seems to be consistent with increasing numbers of cases there. The UK is effectively a two-party system. Sometimes it's a 2.5-party system. You do have some regional parties, but typically it's really about conservatives versus Labour. And so you could kind of test your hypothesis there to see whether there's a tendency for, say, Labour voters to be more critical of the current conservative government around responses to COVID. Again, this is the kind of thing that social science research tries to do, is to take these questions and then see about what kind of research design would allow us to answer them. Okay, to what extent do you think the poll results on government response to COVID will be reflected in election outcomes this fall? That's a great question. I think a great question to end our discussion right now. The first answer is, well, it depends on the course of the disease and the course of the virus. I think that it's more likely that the election will depend on the state of the economy than on government responses to COVID, although it's obvious and important to point out that government responses to COVID have enormous economic implications, as we've seen. So the decisions to close or open business, the decisions to open schools, these are obviously consequences of COVID. They have economic consequences. And what we know from past elections is that a great deal of political campaigns, particularly presidential campaigns, are shaped by the characteristics of the economy. So I think to wrap up, again, what we see happening right now, and as we pursue or as we follow the events over the next several months, is going to be shaped by the crisis. Our election is going to be shaped by the crisis. But those perceptions are also going to go back to some of the things that I talked about today about, again, who we trust for information, how we define this moment in terms of who is to blame, how actions lead to consequences, how we understand why we're in the current moment we are with respect to government policies, and finally, who we think really deserves help, and whether or not we think that help so far is going to those who we think actually need it. So with that, I will finish up this session of Hopkins at Home. I want to thank everybody for your questions and for tuning in, and stay safe and stay healthy.